Once upon a time, I was a graduate nurse that shockingly just happened to be good at inserting IVs. They just kind of slid in, and I was working with pediatric and neonatal patients and inserted quite a few of them. As I began to do more and more in the hospital and then later out of the hospital in home infusion, I discovered how common it was for pediatric patients to need IV therapy at home and have to have IVs restarted over and over. My heart just went out to them because I wanted to have something that would last longer, some type of device that we could use for the whole length of therapy. This was quite a while ago, even before PICC lines and midlines became common. And so when I first heard about PICC lines, I was ecstatic. It was the answer to my dream to be able to put in something longer, something that I wouldn't have to stick the kids over and over. And then later, as I started using these devices, PICC lines and midlines, I discovered that there was also a need in the geriatric population with my older patients. And so application of PICC lines and then more and more midlines during this period of time made it so much easier for the patients to receive their therapies in a way that caused less trauma, a way that made it more comfortable for them. And so I've just been so thankful to have the opportunity to have different types of devices to use for patients that would allow them to have a better experience overall. Within all that, it was such a pleasure to be able to provide patient education and help them to become more familiar with the devices that were available so that they could have a vote in the process, so that they could be involved in the therapy decisions. That need to educate the patients became more of a need to educate nurses and doctors. And so when I became involved with PICCs, I started doing education, and then ultrasound came into play, which again was another answer to a dream, because now I could see inside the patient's arms and be able to know exactly where to put the needles and insert the devices. And so I feel very fortunate to be able to work with patients, work with technology that allows us to do such a better job in placing lines so that patients could get the therapies that were ordered and complete the process and really become cured of their illnesses and have a better experience overall. I'm just thankful to have had these opportunities. And that's my story.